My name is Jill Sukraw, and my PI is Dr. Joseph Cheever, and my project is on early surgical intervention and developmental outcomes in patients with Crouzon syndrome. Crouzon syndrome is a craniosynostosis disorder characterized by premature fusion of cranial sutures, resulting in midface hypoplasia. Shallow orbits and functional impairments involve airway patency, vision, occlusion, and intracranial pressure. Midface deficiency is among the most clinically significant features and frequently requires staged surgical intervention during childhood or adolescence. Early diagnosis of and appropriate surgical timing are critical, as progressive cranial restriction may lead to neurodevelopmental compromise and elevated intracranial pressure. Surgical management aims to balance functional improvement with facial aesthetics. While early intervention may alleviate airway and intracranial constraints, it has been associated with higher complication rates, necessitating individualized treatment planning. Midface advancement procedures, including Lefort 3 osteotomy and distraction osteogenesis, have demonstrated predictable skeletal correction and improvements in airway and ocular function. Advances in surgical algorithms and outcome assessment underscore the importance of multidisciplinary longitudinal care in optimizing long-term functional and skeletal outcomes for patients with Crouzon syndrome. For the objective of this research is to evaluate surgical timing, technique selection, and functional outcomes in patients with Crouzon syndrome, with a particular focus on midface advancement procedures. The study aims to synthesize current evidence of craniofacial growth patterns, airway changes, and skeletal stability following surgical intervention, and to assess how timing and procedural choice influence both short and long-term outcomes. By integrating findings from existing literature, this research seeks to clarify optimal treatment strategies that balance functional improvement, aesthetic outcomes, and complication risk in the management of Crouzon syndrome. The methods for this research or that this literature reviewed synthesized findings from peer-reviewed publications addressing surgical timing, midfacial advancement techniques, craniometric and aesthetic outcomes, airway changes, orthodontic considerations, and long-term growth patterns in patients with Crouzon syndrome. The review was based exclusively on a predefined set of patients with Crouzon syndrome and was set This literature review synthesized findings from peer-reviewed publications addressing surgical timing, midface advancement techniques, craniometric and aesthetic outcomes, airway changes, orthodontic considerations, and long-term growth patterns in patients with Crouzon syndrome. The review was based exclusively on predefined set of articles provided by the authors and included randomized studies, retrospective studies, and reviews and systematic reviews, surgical case reports, and long-term follow-up studies published between 1986 and 2025. Eligible studies included patients diagnosed with Crouzon syndrome or syndromic craniosynostosis with Crouzon features and evaluated surgical interventions such as cranial vault remodeling, Lefort 1 or 3 advancement, monoblock distraction, rigid external distraction, and adjunctive orthognathic or airway procedures. Data extracted from each study included study design, patient characteristics, surgical techniques, outcome measures, and duration of follow-up. Primary outcomes of interest included craniometric and aesthetic changes, complication rates relative to surgical timing, airway dimension changes, post-surgical growth trends, and functional outcomes related to breathing, occlusion, and vision. Findings were organized into thematic domains encompassing surgical timing and complications, midface advancement outcomes, airway and respiratory effects, and growth development. Aesthetic results and syndrome-specific orthodontic considerations were also included. A narrative synthesis approach was used to integrate results across studies and identify consistent trends, variations, and methodological strengths and limitations. In the results, 14 peer-reviewed studies evaluating surgical and interdisciplinary management of Crouzon syndrome were analyzed. Despite methodological heterogeneity, consistent trends emerge across 6 major domains: surgical timing, mid-face advancement outcomes, airway function, and craniofacial growth, aesthetic improvement, and orthodontic considerations. Earlier, craniosynostosis repair was associated with higher post-operative complication rates, particularly in patients younger than 6 months, although delaying intervention increased risks of evaluated intracranial pressure and airway compromise. Mid-face advancement is the most commonly via Lefort 3 osteotomy with or without distraction, produced consistent improvement in facial projection, orbital protection, occlusion, and airway patency. While partial relapse during growth was reported, post-operative facial harmony remained superior to preoperative baselines. Airway outcomes showed measurable increase in upper airway volume in pediatric patients and improved nasal airflow in adults following surgical intervention. Longitudinal studies demonstrated improved craniofacial growth, trajectories after surgery, although intrinsic growth deficiencies persisted. This often required staged procedures. Meta-analytic and cohort evidence confirmed significant aesthetic and craniometric improvements across techniques. Early orthodontic intervention was consistently identified as essential for optimizing surgical outcomes in occlusal development. For the conclusion, this literature demonstrates that optimal management of Crouzon syndrome requires a long-term, staged, multidisciplinary strategy tailored to patient-specific anatomical and functional needs. Early cranial vault expansion protects neurological development, while mid-face advancement profoundly improves airway function, occlusion, and facial balance. Long-term follow-up and orthodontic or orthognathic refinement are essential to address persistent growth deficiencies. Consistent evidence across decades shows that modern surgical interventions offer reliable aesthetic and functional improvement when carefully sequenced and integrated into comprehensive craniofacial care. For future discussions, what might lead to other research is going to be regarding early surgical intervention in patients with Crouzon syndrome. They should focus on balancing the benefits of early craniofacial correction with the potential risks and long-term outcomes. Early intervention, often performed in infancy or childhood, aims to address craniosynostosis, prevent abnormal cranial and facial growth, and reduce the risk of elevated intracranial pressure. Airway compromise and ocular complications are among this list as well. Evidence suggests that timely mid-face advancement and frontal orbital remodeling can actually improve both functional outcomes, such as breathing or vision, and feeding and psychological development, by normalizing facial appearance at a critical stage of growth. However, with the timing, the sequence and type of surgical procedures remain a point of debate, as a premature intervention may also necessitate additional revision surgeries, while delayed treatment could also allow progression of deformities that are harder to correct in the future. Discussions should also consider the integration of multidisciplinary care, including orthodontics, neurosurgery, and otolaryngology, to optimize both skeletal and soft tissue outcomes. By critically evaluating patient-specific factors like the severity of craniofacial deformity, growth potential, and other comorbidities, clinicians can refine treatment protocols and improve long-term quality of life for individuals with Crouzon syndrome. Thank you for listening, and take care.